Scenario: anxious lady who is having surgery soon. Good afternoon. I'm Lilian of the surgical doctors working here. May I confirm your name and age, please? Hi, doctor. Yes, my name is Ramisa, and I am 45 years old. Nice to meet you, Miss Ramisa. I will be your doctor today. How are you feeling today? I've been feeling quite anxious lately. I've been experiencing shortness of breath, especially in the past few days, and it's been really bothering me. I'm sorry to hear that, Miss Ramisa. Anxiety can be quite distressing, especially when it affects your breathing. Would you like me to give you some oxygen to help you feel more comfortable? Yes, please. That would be helpful. Doctor administers oxygen to the patient. Now, let's discuss your symptoms in more detail. Did your shortness of breath start suddenly or gradually? It's been there for about 10 days now, but it's gotten worse in the past 4 days, especially since I found out about my scheduled cholecystectomy. Ms. Ramisa, has this condition been improving or worsening over time? Worsening over time. Does it happen all the time, or does it come and go? It comes and goes, but it's been happening more frequently lately. The episodes usually last for a few minutes each time. Ms. Ramisa, have you noticed anything that triggers or worsens these episodes? It seems to get worse when I'm feeling particularly anxious or stressed. Are there any factors that seem to make it better? Taking deep breaths and trying to calm down usually helps a bit. Differential diagnosis: 1. Pulmonary embolism. Ms. Ramisa, do you have any chest pain? No. Did you notice any calf swelling or pain? No, doc. Ms. Ramisa, did you vomit? No. 2. Malignancy. Did you notice any unintentional weight loss? No. Ms. Ramisa, how about your appetite? It is the same, doctor. 3. Pneumonia. Have you experienced any fever, coughing, or brought up any mucus? No, I haven't had any fever or coughing, and I haven't noticed any mucus either. 4. Heart problem. Do you feel aware of your heartbeats, or have you experienced any difficulty breathing when lying flat? I don't notice my heartbeats unless I'm feeling anxious. I haven't had trouble breathing when lying flat either. Past medical and surgical history. Ms. Ramisa, did you experience similar symptoms before? Yes, when I'm overwhelmed. Were you diagnosed with any medical condition? No. Ms. Ramisa, have you had a history of surgery before? No. Family history. Is there anyone in your family who experienced similar symptoms before? No. Drug history. Ms. Ramisa, do you take any regular medication, like blood thinner medication? No. Do you have allergies? No. Social history. What do you do for a living? I am an accountant. Who lives with you? My family. Ms. Ramisa, do you have any difficulty with stairs? Sometimes, doctor. Idea, concern, expectation, ice. What do you think might be the cause of your symptoms, Miss Ramisa? I don't know. What is your main concern? Maybe I will die. Don't worry, we will take care of you. Systemic review, Ms. Ramisa. Do you have a headache? No. Any chest pain? No, doc. Do you have any tummy pain? No. Do you have a problem with your bowel or bladder? No. Thank you, Miss Ramisa. That's reassuring to hear, doctor. Thank you for taking the time to listen to me and explain everything. You're welcome, Miss Ramisa. It's important for us to address your concerns and ensure you feel supported throughout this process. We'll continue to investigate and keep you updated every step of the way. Discussion. Summarize your case. I took clinical history from Miss Ramisa, 45 years old. She has been experiencing shortness of breath for 10 days, with episodes lasting a few minutes, worsening in frequency in the past days after being scheduled for cholecystectomy. The shortness of breath does not fit with cardiac or pleuritic chest problems. My top differential is anxiety related to her impending operation. I will also consider interstitial lung fibrosis, bronchial asthma, pneumonia, PE, and bronchogenic carcinoma. What is your management? First, I will perform a full clinical examination, including chest and cardiovascular examination. Then, I will contact the GP to obtain all the notes regarding the patient's investigation. I will order or repeat investigations, including ABG, CBC, ECG, chest X-ray, and pulmonary function tests. I will ensure she has a recent angiogram and discuss this with a cardiologist. Reassurance is crucial. I will involve her close relatives or friends to ensure an adequate support network. Should the surgery proceed, as there is no evidence of cardiac or respiratory illness, the operation can proceed. Your second differential diagnosis is interstitial lung fibrosis. So answer these questions. Define FEV1, volume of air exhaled at the end of the first second of forced expiration. Define FVC, the amount of air that can be forcibly exhaled from the lungs after taking the deepest breath possible. FEV, 1/FVC ratio. In obstructive lung disease, it is reduced, less than 70%. In restrictive lung disease, it is normal or increased. Thank you, doctor. You can proceed to the next station.